This is the Kidney Health Series, brought to you by Narmada Kidney Foundation and supported by Dr. Reddy's Lab. Hi friends, and welcome to our very first show for 2014 on the Kidney Health Series. So I'd like to take this opportunity and wish each and every one of you a very happy new year, and thank you for all your support that you've given us in these past 2.5 years, and we're running into the third year right now, so it feels great. We're in conversation with laparoscopic surgeon Dr. Pradeep Rao. He was with us in the December episodes. Welcome back to our show, Dr. Pradeep Rao.
Thank you, Bosco, and a very happy new year.
And today we're going to talk about the most interesting topic, which I'm sure a lot of people have probably gone through this phase of their life at some stage or the other, and that's about urinary stone diseases. Doctor, the very first question I'm going to ask you is this: how do these stones get formed? And second is, where do they form?
Most of the urinary stones form in the kidney. There are a few which can form in the bladder, but we don't see these often these days. The commonest ones which we see in India nowadays are those which form in the kidney. From the kidney, as the body tries to push the stone out because it's a foreign body, it goes through the ureter and the bladder, and that is where you find these stones in the ureter and the bladder. This is because ureteric stones and bladder stones are symptomatic. That is, they cause you pain, they cause some bleeding. And usually kidney stones can remain asymptomatic if they are in just one corner of the kidney, not blocking any part of the kidney.
Right.
But they almost always form in the kidney. A few stones do form in the bladder, but we don't see them often these days. These are usually when the bladder is blocked because of the prostate, or if there are children with severe malnutrition, which we used to see in the olden days in India, but not so much anymore. So usually the commonest stones which we see today are the ones which form in the kidney, which may be in the ureter or in the bladder when they are found.
Right. But doctor, the primary question is, how do these stones get formed?
So the primary cause for forming a stone in the kidney in our country is usually dehydration.
Okay.
We're a tropical country where people sweat a lot. People tend not to drink much water, and the urine gets concentrated. As any chemistry student will tell you, there is a supersaturation of salts in the urine.
Right.
And when the salts cannot remain in solution anymore because the urine becomes concentrated, they crystallize. Once there is one small crystal in your kidney, it works as a nidus for stone formation. So the crystals keep on getting deposited on it, and over a period of time, it becomes a stone.
And doctor, how does one suspect that there is a stone in the kidney?
So usually these stones, if they are in the kidney, they may remain asymptomatic and be picked up only during a routine medical checkup.
Right.
But when the stone moves into the ureter or comes into the bladder, these are extremely painful. The pain suffered from a ureteric stone, we compare it as second in intensity only to that of labor pains.
Right.
So it's one of the most severe pains that any human being can undergo.
Right.
Anybody who's been through an attack of a ureteric colic, that is a stone being stuck in the ureter, will never forget it. Because the ureter is a tubular structure, when it is blocked, the first instinct of the kidney, the natural instinct of the body, is to expel this invader.
Right.
So the kidney tries to produce more urine and push the stone out. It does this, the ureter gets stretched and distended, and this causes very severe pain. So what happens is that for up to 24 to 48 hours, the kidney will keep trying to push it out. And then the kidney shuts itself down temporarily. This is a natural protective mechanism of the body to prevent the kidney from bursting. Because obviously if the urine keeps on trying to come out and the stone is blocking it, something has to give. So the body's mechanism is to shut down the kidney temporarily and give it some rest. Then after a few days, it may try again. That's why these attacks of pain can be recurrent. Also, every time the stone moves down, there is usually an attack of pain.
Oh yes, so, I can imagine, right. That
so pain is actually a good thing when you have a kidney stone, because it means your body is trying to get rid of the stone and the kidney is functioning well. Sign of pain is actually shows you that your kidney is functioning, but you don't want to wait too long because it can be very severe pain.
What are the symptoms?
So usually when a stone is stuck in the ureter, the feeling is initially of discomfort, feeling of fullness. You might feel like you have a gas or something, and you might feel like passing urine but find that nothing much comes out.
Right.
And then you may get a very severe pain which radiates from the back towards the front, towards your groin. And this pain can be very severe in intensity and is usually followed by vomiting. What happens is that the nerve supply of the ureter and the bowels are the same. In its keenness to shut down the pain, sometimes the body makes you throw up. because the bowels have the same nerve supply. In fact, if the pain lasts for more than 1 or 2 days, you will find that the patient will find that he's being constipated as well, because the bowels don't move as well when you have a ureteric colic. These are the commonest signs and symptoms. Bladder stones can just present as severe burning or difficulty in passing urine, with occasional blockage of the urine as well if the bladder stone blocks the opening of the bladder. And kidney stones, although they remain asymptomatic, they may present as urinary infection or occasionally with little bit of blood in the urine.
Right, doctor. And what's the treatment that's adopted for something like this? Now, I guess there are various, it depends on which stones actually pass on its own.
Right.
And how would you explain that further?
So, if the stone has reached the ureter, the natural mechanism of the body is to try to push it out.
But that depends on the size of the stone as well, right?
Yes, absolutely.
Okay.
So, on an X-ray, a 4 millimeter stone will pass about 95% of the time. A 5 mm will pass about 85 to 90% of the time. A 6 mm will pass about 75-80% of the time.
A 1 inch will just stay put.
A 1 centimeter is very unlikely to pass, not just because it doesn't come down the ureter well, but it doesn't pass out of the urethra as well, because it gets blocked when you're trying to pass it.
So then the treatment that's adopted for this, in this case, I think there are various treatments. There are people that go in for allopathic, there's homeopathic, there's Ayurvedic. Does it really work?
So if there is a ureteric stone, it's the body's natural mechanism to push it out.
Right.
And no treatment, medical treatment really works in pushing it out. All the medical treatment can do is reduce the pain and be supportive. And once the stone has come into the lower ureter, we have drugs now which can help the stone to pass by relaxing the lower ureter and the bladder.
Oh, is it?
Yes. But by and large, the passing is natural.
Okay.
So if any doctor comes and tells you, I'm going to give you medicine to help the stone pass, it is unlikely to do
But then
that.
I guess in this case, the patient needs to hydrate a lot, drink a lot of water to actually pass the stone.
The hydration actually helps to reduce the pain. It doesn't help so much to pass the stone.
Oh, okay.
The hydration does reduce the pain, and it is recommended. Also prevents further stone formation. But the stone passing essentially is a natural process.
Okay. And what are the surgical options over here?
This is treatment of stone disease, which has developed over the last 30 or 40 years, is one of the true modern medical miracles.
Okay.
It's really one of the miracles of the 20th century. And the person who invented lithotripsy, which was the first non-invasive treatment for stone disease, and actually for pretty much any disease in the body, is one of the miracles of the 20th century. This is Christian Chaussy from Germany. He saw that when the supersonic airliner, the Concorde, when it was going over, glasses used to crack, but nothing else would be harmed. So the principle that sound waves at a certain intensity could break a brittle structure, that is the principle on which lithotripsy is based. And in 1980, the first extracorporeal shockwave lithotripsy, which a lot of people in India call this laser, but it's not really laser, it's sound waves which work that.
Sure. Doctor, you were telling us about this non-invasive...
extracorporeal shockwave lithotripsy, also known as ESWL.
Right.
Now, the thing is, when it came in 1980, it was like magic. The patient would just lie down on the bed, the machine would be placed at his back, and he would go home stone-free. And the early machine, the first one which came in, was pretty good actually, with about a 78 to 80% success rate. But it was a very powerful machine, and it could damage the kidney over time. So as the years have passed, the machines have become more sophisticated, but they have become also less effective. So nowadays, although we do use this technology to treat stones, it's best used for kidney stones, which are in the right place in the kidney. And if you're careful with this, you can have a high success rate when you choose the right patient.
Right.
It's possible to have success rates up to 85 to 90% with this particular technology, as long as the right patient is chosen. What did happen was, in the 80s, we didn't have any other technology to treat kidney stones. It was either open surgery with a huge incision or lithotripsy. And lithotripsy was preferable even with a 70% success rate. Because in the other 30%, you could always go back and take the stones out.
But this is still done under anesthesia.
No, this lithotripsy is done without anesthesia.
Without anesthesia.
A good quality machine does not require anesthesia. There are a lot of varieties of machines that you get. There are some machines which do require anesthesia because they're more painful.
But in the process of the stones being broken down, when the patient actually passes urine, those fragments of the stones would be passed
Yes.
Right?
So,
but then
so
that's
can be
painful.
painful.
That
Yes,
can be very
exactly.
painful. And this takes a while until it's completely
Absolutely.
cleaned up, right?
Absolutely.
Yeah, right.
And that is one of the reasons that this technology is not used so much these days.
Right.
We have it available with us for the selected
What's
patients.
the latest technology that's adopted now?
So there are 4 or 5 really new technologies which work very well. And these actually involve a laser machine.
Okay.
As against Eswl, which is not genuinely laser. So we actually use a laser, which is a holmium YAG laser, to powder the stones. But this is done intracorporeally. So we have 2 methods in this. One is we can take a needle now, pass it through the body, right into the kidney, see the stone, and under vision powder it. And the other is we have these special delicate instruments. I think that we can talk about this in the next program.
And we're going to continue with the conversation from last time. Doctor, we need to talk about so many things. We talked about surgical aspects.
We were talking about the endoscopic surgery for stone disease.
Right. I think we should
continue
with that.
And the latest treatment. Yeah.
Right.
So now we actually have very tiny miniaturized instruments which are about 2 millimeters in diameter, which can pass all the way up the urinary passage using the natural orifice in the body, which is the urethra, go up into the kidney, and using a laser, which I talked about last time, we can powder the stone completely. And this is because it's done under vision and under the control of the surgeon, ensures complete clearance of the stone.
Right, because I think there's a complete bladder wash also that's done.
Oh, yes. So what happens in this procedure is that we don't have to admit the patient overnight.
Right.
If we give the proper anesthesia, we can let them go the same day. Because, as you can imagine, 2 millimeters is a very small instrument and very tiny instrument.
Right.
It's a delicate instrument, but in the right hands, it can work wonders.
And this is done under anesthesia.
This is done under anesthesia.
But once the anesthesia wears off, the pain is still there to a great extent.
No, usually this procedure is painless.
Okay.
But there are other procedures also done for stones, slightly older procedures, which we do for bladder stones, which we may do for larger kidney stones, which may have some degree of pain once the anesthesia wears off. But usually the pain is short-lived for a day or so.
Right. Doctor, from your experience all these years, which has been the most difficult scenario that you've come across as far as kidney stones go?
So patients who have stones in the upper ureter are very difficult to treat.
Right.
Patients who have very large stones in the kidney, like staghorn calculi, these can be really challenging to treat. And they require a significant amount of expertise to treat these particular stones.
Doctor, now we're going to come to the most interesting part, and I'm sure listeners will definitely want to know, is the dietary restrictions that are involved over here.
So this is one of the biggest myths, part of the dietary restrictions.
Yes, the biggest myths are, I think what people talk about is you cannot have tomatoes, you cannot have, your bindis, anything to do with seeds, you cannot have.
Actually, that is a complete myth.
Is it?
I don't think things with seeds have anything to do with stones. But what is important in stone disease, the first is there should be an adequate water intake. Like I mentioned in the last program, you don't want your urine concentrated.
Right.
A good rule of thumb is your urine should look clear and not dark yellow.
Right.
If it's looking dark yellow, you're drinking too little water.
Right.
And you have a risk of forming more stones.
Right.
The second most important restriction in India, you need to have low salt diet. People tend to put additional salt in their food. Most of our fried foods, namkeens, which you have a high salt content. And salt is one of the major causative factors for kidney stones. So you need to reduce having additional salt in your diet.
Right.
Once you get past this, we know that most Indians are predominantly vegetarian. Even the Indians who eat non-vegetarian food have a predominantly vegetarian diet as compared to Western countries. This means that calcium in our diet is very low. And a low calcium in the diet actually predisposes to forming kidney stones. So I urge people who are vegetarian and even people who are very occasional non-vegetarians to have adequate calcium in their diet. And this means that if you are not eating much meat or fish, you need to have some milk or milk product in your diet. If you do not have this, you're at risk for forming kidney stones.
Email that came in, and this person that says, I used to live in Rajasthan for a couple of years and now settled in Bombay and had a problem with stones. And he also says, my uncles and my aunts too had a similar problem. Is it genetic?
Yes, Bosco. There are many diseases which are genetic, especially stone disease, you have a very, very strong genetic background in patients, especially who are suffering from a genetic condition which is known as primary hyperoxaluria. There are variants of primary hyperoxaluria, and you would find that many patients, they would present with stones. There are other conditions which is known as multiple endocrine neoplasia, which predisposes you to develop something called as a primary hyperparathyroidism, where there's a tumor of the parathyroid, and because of which you tend to develop recurrent kidney stones. And we had a few patients who had a history of recurrent kidney stones, and on evaluation of those stones, we found that they had a parathyroid adenoma. Once those adenoma were removed, the stones were cured. There are some other rare genetic disorders like mutations in the chloride bicarbonate channel, which presents as distal RTA, which is more common in children, and a recurrent stone in children should be extensively evaluated for the genetic causes. And nonetheless, you have some familial hypercalciuric hypercalcemia, where you tend to develop a lot of stones. There are certain genetic mutations in the which causes calcium phosphate stones, which is the distal artery, which is a totally different type of stones. And if you see the calcium phosphate stones, usually one tends to think about genetic mutations. There are xanthine stones which are common. There are cystine stones which are a rare form of stones. There is one stone which we had recently diagnosed, that is 2,8-dihydroxyadenine, which is extremely rare, one of the rarest of the rare cases.
Why do you say rare?
Because they are found in maybe 1 in some 10,000 cases of stones.
Oh, is it?
It's so rare.
Mm-hmm. Doctor, you were talking about evaluation. Dr. Pradeep Rao, how frequently should one evaluate for stones?
So once a person has a stone, there's a 70% chance of getting a stone again. Mm-hmm. And you want to catch that when it's really small and make sure it passes off with medical treatment.
Right.
So I would suggest an ultrasound every 6 months for the first couple of years after the stone, and then maybe every year thereafter, and a urine examination at around the same time. If either of these shows an abnormality, further investigation can be done.
Doctor, the most important question over here is the kind of foods that need to be avoided for patients with stones.
This is a very common question asked to me by all patients who come to us. And I think the most important foods to avoid are those containing oxalates, that is tea and coffee, especially black tea, black coffee.
Oh, is it?
Any colas.
A lot of people have at least 10 cups of tea in a day.
But in India, by and large, people have tea with milk.
Right.
And that tends to reduce the problem, because any oxalate containing food, if you have it with a calcium product, it binds in the intestine and prevents absorption of the oxalate.
Okay.
And the person is fine.
So then it's not so bad after all.
No, but colas are bad because you can't mix them with milk.
Right.
Black tea, black coffee, any berries of any sort, if you're having them without ice cream. Green leafy vegetables. That is why many of our traditional Indian recipes include a green leafy vegetable always with a milk product, like methi is eaten with curds.
Sorry to interrupt. Why berries? Like even
they
strawberry?
have high oxalates, yes.
Oh, high oxalates.
High in oxalate.
Okay.
Even the boar is high in oxalates. So any sort of berry is high in oxalates.
All right.
Green leafy vegetables are high in oxalates, spinach and methi and all this stuff.
Yeah, right.
So all these things have high oxalates. You need to cut them down.
Doctor, here's another email that says, I'm an airline pilot and I have a 2 mm stones in both my kidneys.
So this
is that all right?
No, really what happens is that if he's a pilot and on his annual medical checkup, he has stones, he will not be allowed to fly. The DGCA, as with every other body which controls aviation all over the world, will not allow a pilot to fly with a stone, however small. If you or I had this stone, it doesn't require any treatment, just a regular follow-up.
Right.
But a pilot needs to get it removed because the pilot will not get permission to fly. Okay. Abroad, this is the same with bus drivers as well. Because these people, pilots, bus drivers, they hold the lives of a lot of people in their hand.
Right.
And if they get a sudden colic while doing their duty, it can cause an accident. So they do not get permission to fly with a stone.
Doctor, one last one. There's an SMS that came in that said, I've had 3 episodes of stones in the last 2 years.
So our recommendation is for any patient who has multiple stones, bilateral stones, or recurrent stones, is that they undergo a full metabolic evaluation to rule out any metabolic cause for stone formation. If we can find a metabolic cause for stone formation, we can prevent the stone from happening again by treating that metabolic cause. Whether it is increased calcium in the urine, increased uric acid in the urine, or it's increased oxalates in the urine. We can prevent the stone from forming again with any of these causes once we can target it. So the important thing is, once the stone is removed, you need to tell your doctor, please investigate to find out why I'm getting the stones again and again.
Right. And one last one, it says, there's this guy who has, I don't know if it's a myth, but he says with recurrent stones in the bladder, does it affect the prostate?
Not really.
Not really. But
the prostate enlargement can cause recurrent bladder stones.
Right.
But the stones themselves do not affect the prostate.
But I think that's a different subject altogether, and I think it's another very important topic that we need to talk about. We'll probably take this topic in the next session. And Doctor, what is exactly that you want to highlight in our next episode?
So we have two types of prostate issues which affect the general public. Benign prostatic hyperplasia,
right,
which happens in everybody beyond the age of 50,
right,
which is a part of the natural process of aging,
right,
and prostate cancer,
okay,
which is also, as many people will tell you, part of the natural process of aging, but at an older age.
Right.
So these are two very important public health issues I think we need to discuss in our next.
You were listening to the Kidney Health Series, brought to you by Narmada Kidney Foundation and supported by Dr. Reddy's Lab.